activities, also education events. And then we also do presentations around the state. We visit you and share with your organization or with the community if you do some of the outreach for us to get those folks there. So there's a request for a presentation form on the website. Some of our social media stuff you can share really easily. You can copy our content. Some samples of that are later in this webinar. That will take place at facebook.com/enrollnebraska and on Twitter @enrollnebraska. And we'd love for you to follow us and keep track of what we're up to. So what we are going to do today is keep spreading the word about our education and engagement group. Lots of the enrollment assisters around the state are really busy right now enrolling people in ACA coverage. They set appointments, folks come in, they get enrolled. They spend 8 hours a day doing that, and Saturdays and extended hours. What we are asking folks who engage in this conversation to do is become the outreach and awareness and referral portion of those assisters and of Enroll Nebraska. So what we're doing is giving you the tools to do that easily, educating you about how that works, and hopefully getting some partners that can stick with us through the years and keep us moving toward getting more and more people involved. We meet quarterly, and as we said, it's for organizations, churches, schools, folks who are interested in, who deal with folks who need this information. And for you, we think it's a low time investment for a very high impact. One of the main fun campaigns that we're doing this year, I wanted to share about too, is the 2016 and 2016 enrollment campaign. And I just threw this in there so that folks can see a little bit of the heart of Enroll Nebraska. We are trying to enroll 2,016 people in coverage in January of 2016. And we're doing that right now through January 31st. So we created a little promo video. We'd love for you to watch and share on social media. And also share with the hashtag 2016 and 2016. We have a report out, hopefully in the next day or two, that will share how we've done between January 1st and January 16th. And people in this group will get an email from us, people on this webinar, telling about how well we've done so far. We'll also report back how we did completing after January 31st. So generally that is the 2016 and 2016 campaign. We'd love to share more information. And you can find more out at enrollnebraska.org/2016. So next, I wanted to introduce our speaker for the day. It's again Molly McCleary with Nebraska Appleseed, and she is going to share some of the more salient and easily understandable parts of the exemption process. There are tons of people out there who don't know a lot about the ACA. There's even more out there who don't really know about the exemptions for folks who do not qualify or who run into specific problems with the ACA. So to get us started, I'm going to hand it over to Molly.
Hi, everybody. As Eric mentioned, we will talk today about the ACA shared responsibility payment, or what is also known as the tax penalty for not having health insurance coverage. And then we'll also talk about exemptions, which are the way you get out of paying that penalty. Before we begin, I just want to go over a couple kind of preview pieces for the webinar. This is a really complicated topic. There is so much information in here, way more than we could cover in just an hour. And so if you feel like it's complicated, you are in good company. It's hard to understand, but we'll do our best to give you kind of the basics of what people might ask you for or what information folks on the ground might need. If you have a question about your specific circumstances or someone's specific circumstances, if they have a complicated income situation or a complicated tax situation, if they've moved around a lot, something like that, the best place to go in your community is to see a navigator about this and dig in a little more. We'll do an overview of what this tax penalty is and how much people might be facing in penalties this year and in the years ahead. We'll talk about the different kinds of exemptions that people might qualify for. There are different circumstances that might make you eligible for an exemption, but then there are also different ways to claim those exemptions, whether that's to go through the marketplace or whether you can wait and do it on your tax form when you file your taxes. So we'll walk through all of that, and then as Eric mentioned, there are some good resources out there that make this pretty, well, not easy, but much less complicated, some good cheat sheets that we'll share with you. So the first thing to talk about is the shared responsibility payment or the tax penalty. This is why exemptions are so important. Everyone under the Affordable Care Act has to have minimum essential coverage, or they have to have an exemption, or they will be subject to paying this penalty for each month of the year that they're not insured. So minimum essential coverage means that you have to have essentially good insurance coverage that covers things that you need. Plans have to cover certain things to be considered that minimum essential coverage. So all plans on the marketplace have to cover what are called the essential health benefits. And also plans like Medicaid, Medicare, or most employer coverage would count as minimum essential coverage. Some people who might have catastrophic coverage if they're not under 30, or if they have some plans that have like a really high deductible and don't cover things, might not be considered minimum essential coverage. When I say that you're paying the penalty for the months that you're not insured, if you are insured for part of the year and not another part, the penalty is prorated based on the number of months that you are not insured. And we'll explain more of that later, how that is calculated. And then the exemptions that we'll talk about are based on individual circumstances. So let's talk about the amount of the penalty. In 2015, so on 2015 taxes, the penalty is the greater of 2% of a person's household income above the tax filing threshold, or $325 per adult and $162.50 per child, up to a total household amount of $975. So if you're subject to the penalty, basically there is an assessment of whether it would be more money to charge you that 2% of your income over the tax filing threshold, or the flat dollar amounts up to the cap. This is, like I said, a full year payment amount. And so if you are, uninsured for 6 months or uninsured for 7 months or something, you wouldn't have to pay for the months that you were insured. So for 2016, that penalty will increase, and then in 2017 and after that as well. So in 2016, the penalty increases to 2.5%, or $695 per adult, or $327.50 per child, up to $2085. So it increases pretty considerably. That's why it's increasingly important to either get enrolled in coverage or to know that you're covered by an exemption, so that you don't have to be subject to those pretty high penalties. It's important also to note, when we're talking about 2% of household income above the tax filing threshold, if someone is low income and they don't have to file taxes because their household income is below that tax filing threshold, so they don't have to file taxes annually, there's no penalty in that situation. And so that's why it looks at that income above that threshold. Just before I go to the next topic, I will say that one of the resources that we will point you to at the end of the webinar has really good sort of example scenarios and hypothetical situations where it walks through different families and different households to show how this fee is calculated. And so I think those can kind of give you some good real world examples of how that might come into play. So when we're looking at exemptions, so trying to avoid that fee, there are different kinds of exemptions depending on your circumstances. We'll walk through some of the big ones that you might see. Depending on the type of exemption, so depending on the type of circumstance, it's claimed differently. So some exemptions you have to go through the marketplace and go through a process to get documentation that you have an exemption, and then put that documentation into your tax filing. Other exemptions are granted by the IRS, and you can essentially just fill it in on your tax form when you're filing, so you don't have to go through that extra step. Some exemptions are granted at either place. So as if they could make the system more complicated, they have some things that you could do with both. We'll talk about each of these different categories and what kinds of exemptions fit into those. It's important to know that all exemptions have to be noted on your taxes when your taxes are filed. It's on Form 8965. So whether it's a marketplace exemption or that tax filing exemption, there's a form on your taxes where you have to note that or you won't get the exemption. So let's talk about what these types of exemptions are. If you experience hardship, you can qualify for an exemption. This means this is a number of different personal circumstances that could be defined as hardship. If you experience domestic violence, if you have homelessness, if you are in a natural disaster that resulted in significant property damage, all of those are kinds of things that could be considered exemptions or hardship exemptions. There's a long list of those that if you want to apply for a hardship exemption, you'll see the long list. So a lot of different people could fit into that category. One important one for people in Nebraska is the Medicaid coverage gap qualifies as a hardship exemption. So if a person lives in a state like Nebraska that has an expanded Medicaid eligibility to low-income adults without dependents between 0 and 133% of the federal poverty level, or low-income parents, some working low-income parents who maybe make a little bit more money but still don't have enough money to purchase insurance on the exchange and get subsidies. If people fall into that category, that's considered making them eligible for a hardship exemption. We'll walk through that one in more detail because I think that one will come up maybe more frequently than some of these other ones. Unaffordable insurance is another one. So if you go onto the marketplace and none of the premiums are less than 8.05% of your household income, you could qualify for an exemption. Some religious sects object to having health insurance. So if you're a member of that such an organization, you can be exempt. As I mentioned, if your income is below the tax filing threshold, you're not filing a tax return, so you can't be assessed a tax penalty. Certain non-citizens, so if you're not a U.S. citizen, if you are a citizen that's living abroad, or if you're undocumented or DACA, you can get an exemption. People who are incarcerated are exempt for the months where they're in a corrections facility. Members of health sharing ministries, members of federally recognized tribes, and then also short gaps in coverage, so less than 3 consecutive months in a gap in coverage. So if you, for example, lost your job in July and got a new job and you lost your insurance with that job and you got a new job in September, that would be less than 90 days, and so that would count as a short gap in coverage. So 1 day of the month being covered means you're covered for the whole month. So you'll have to kind of go through the calculations and make sure that you're under that 3 consecutive month threshold. So when we talk about these different kinds of exemptions, as I mentioned, there's marketplace exemptions and then there's IRS exemptions. So for some of these circumstances that you fit in, you have to go through the marketplace exemption process, which is where you go to the marketplace and you apply for that exemption. if you're granted that exemption, you get a documentation called an exemption certificate number, or an ECN, and that is something that you put on your tax form. There's a place on the tax form that asks for that number. This can take a couple weeks to process because you have to mail the forms in to do this. So that's just something to keep in mind. So these are the types of exemptions that you have to go through the marketplace and get that extra documentation to prove on your taxes. So hardships, including the Medicaid gap. A hardship exemption is, it makes sense that you have to go through the marketplace to get that, because if you think of those examples like homelessness or natural disaster or something like that, you may not be exempt for an entire year. That may be a situation where your insurance penalty or your penalty is prorated because you might not be experiencing that hardship for the full year. If your insurance is unaffordable, if you're a member of a religious sect, or if you're a member of a federally recognized tribe, incarcerated individuals, and then people involved in health sharing ministries. Those are all types of exemptions. You can get that marketplace documentation and note that on your taxes. The three that have the asterisks there, the Indian tribe membership, incarceration, or health sharing ministries, as you'll see, those can be either claimed through going through the marketplace to get the exemption, or by just noting it on your taxes. So the Medicaid coverage gap, there's a lot on this slide because it's somewhat complicated and not really intuitive. So I'll try to walk through this, and hopefully it will make some more sense. So if you live in a state that doesn't have Medicaid expansion, like Nebraska, you are eligible for an exemption. You just have to be a resident of that state at any time during the year. So if you are someone who lived in an expansion state or a non-expansion state for part of the year and then went to another state, so if you lived in Nebraska for part of the year, claimed a hardship exemption for being in the Medicaid gap, and then moved to Colorado and got Medicaid, you would still be considered for the full year as having that hardship exemption. So it's important to, if you're in this situation, claim that exemption when you can. If you have an income, you also have to have an income below 138% of the federal poverty level. Depending on how you apply for Medicaid, it dictates whether you get an exemption automatically or whether you have to go through that process of applying for one. So if you do a Medicaid application, or if you apply for healthcare.gov insurance and you are determined to be ineligible for Medicaid and your income is below 100% of the federal poverty level, you automatically get an exemption. If you file an application on healthcare.gov, you're determined ineligible for Medicaid, but your income is between 100 and 138%, you have to apply for an exemption. This is because people between 100 and 138% could technically get coverage on the exchange, or on the marketplace. If you go through your state Medicaid agency and apply for Medicaid, they tell you that you're ineligible, then you have to go to the marketplace, apply for that exemption, and get that documentation. So there are kind of three different scenarios where a person might fall, and it's important to know which of those situations you fall into. So the next category are tax filing or IRS exemptions. As I mentioned, all exemptions have to be noted on your taxes, but these ones are just, you don't have to do any of that marketplace apply for the exemption business. You can just claim them directly on your tax form when you're filing your taxes. These are things where your income is below the filing threshold, your insurance is unaffordable. If you're a non-citizen, or if you are a citizen living abroad, if you have a short coverage gap, if you can also claim the Medicaid coverage gap one at the time of filing. The Indian tribe membership, incarceration, or health sharing ministry categories, as I mentioned before, can be claimed either way, which is what is reflected on this slide. So this is all, as I mentioned, pretty complicated and hard to go over in such a short amount of time. But I think that by providing these basics, it will help to ensure that you know the right questions to ask when you go through this process. The Enroll Nebraska Assister map, as I mentioned, points out where folks can get in-person help walking through some of these issues. So walking through whether a person might be eligible for an exemption, how to go through that process. The Center on Budget and Policy Priorities has a webinar all about exemptions and penalties. As I mentioned, this webinar has some great hypothetical situations of different scenarios that people might find themselves in, and it walks through both how the penalty would be calculated for them, also whether they would be eligible for an exemption. These are a lot of common situations that I think people fall into, and so I think that is really helpful. If you go to the link, these are all links, by the way. If you go to the link for the CMS Marketplace exemption applications, that is the actual paper form that has to be turned in to get a marketplace exemption. On the beginning or the first page of each of those forms has a good explanation of all the kinds of documentation you would need, all the information you would need to fill out the form, and the folks that are in the situation that would be relevant to filling out that form. The last two resources I think are the best ones for what we talked about today. These are from Families USA. They are two cheat sheets about exemptions. The first one is the types of exemptions that you can get, and the second one talks about that penalty. As you can see, the types of exemptions one walks through the reason for the exemption, where to apply, when you can apply, so whether it's at a tax time, whether you have to go through the marketplace, and then the length of time that you're exempt. So do you get an exemption for a full year, or will it cause you to have a prorated penalty? The next one walks through the requirements to have insurance and how the penalty is calculated and the different kinds of things that help play into that situation.
All right, everybody. So sorry again for the distortion. We've been doing our best to mitigate that a little bit, but working on a new system. So thanks, Molly, for sharing that stuff by video. That was our issue today. I think you were hearing her speak from my speakers into my microphone, strangely. But I've tried to post the two resources she mentioned at the top in the chat box, and then all the rest of the resources are available for download there at the enrollnebraska.org/EEG. So once again, we are taking some questions. If you have them at the end, please type those questions in the box at the bottom right of your screen in the webinar chat portal. But I wanted to also take some time today to talk about resources that we have created to help folks remind folks that we are ending open enrollment on January 31st. So I think at the beginning, if you could hear it, we were mentioning that Enroll Nebraska has a social media presence. At Enroll Nebraska is our Twitter, and facebook.com/Enroll Nebraska is our Facebook. One way to spread the word for organizations is to follow us and then retweet or repost or share things that we share. We're more than happy to provide that stuff over and over. Lots of times it can be easier for folks to do that than anything else. If you wanted to do some of your own, we've created some sample tweets and sample Facebook posts, things that we think are appropriate for any organization to post about. Clearly nothing political, clearly nothing that could be controversial, but any organization would be, people would think you're a good organization to put a personalized estimate of your total yearly insurance cost, and offer some resources for that. And same with things like the 2016 and 2016 campaign that I briefly mentioned, possibly on mute earlier, there at Enroll Nebraska. In this resource, you'll also find a sample email. I have it written there in the subheading. We have this email might be useful to send out to your listservs, hopefully in the next couple days, to remind them that coverage is still available all the way through January 31st. And after that, there are some special enrollment periods. It's simple. It does acknowledge that your organization is a supporter of people having health insurance, which is not that hard of a sell in most places, usually. So we encourage you to take that email, put it in a newsletter, send it to your listserv directly, do something with it that makes sense to you, and also do this social media stuff. All right, so here's a little picture of that email. As I said before, it's available at enrollnebraska.org/EEG. And with that, that's how we plan to end Open Enrollment 3. We are at over 80,000 individuals enrolled in coverage so far. Last year at this time, we were not anywhere near that. I can tell you that we ended open enrollment with 74,000 folks enrolled, and to have 80,000 with about 11 days left, 12 days left, is a very special thing. So Nebraskans clearly do care about healthcare and are embracing this concept of getting it through healthcare.gov. So Molly is not with me right now, but I am here to answer any questions if you have any. Send them through the chat box there on the bottom right, and I will definitely get this video posted with a lot more clarity. This is going to be copying the end of what I've done here, hopefully very clearly, and putting the video that I had played and had on mute here and there all together, along with the presenter slides. Everybody can have those too, but really the resources that you'll find that Families USA has provided and we put on our website at enrollnebraska.org/EEG are probably the best places to look. All right, so once again, we are here to answer your questions, and we will have just about 5-10 minutes to do that, so feel free to type those in as you have them. And all right, so I'll keep talking just a little bit. We are celebrating, today is our report out day for our 2016 and 2016 campaign, our midpoint. We're having people report out how they've done so far with enrollments and assists. So far around the state, we have at least 18 organizations participating in this, and we'll get a good feel for how much more we have to do this last 10-11 days of open enrollment to get to our 2016. All right, so I do see a couple of questions. One question came in from Amelia. Thanks, Amelia, and Ashley, and for being so kind, everybody, about the technical difficulties we had earlier. But more information on the family glitch. So to explain a little bit about that, I'll try to explain what it is. The family glitch is something that came down in the original 2010 ACA law that seems like a glitch in the writing, but it doesn't quite make sense practically for a lot of families. And this is when an employer offers coverage to an employee and their family does not receive the family of that person is offered insurance through that employer, but that insurance is at full cost or is a lot more than that family can afford. From what I know, nothing has moved on that. I think that would take an act of Congress to eliminate the family glitch. It is eliminating some folks from coverage that could be. I do not believe it is a reason for consumers to get an exemption at this point. So I'm going to leave it at that and try to follow up if there is any further information and email the group about that. All right. Another question just came in from Vicky. Thanks, Vicky. A consumer called and wanted to know how they get the 1095 form for taxes. Is this the one that verifies their length of coverage in 2015? All right, good question. Form 1095, let's look at it really quickly. A Form 1095 is something that allows folks to report out their information about individuals who enroll in qualified health plans through the health insurance marketplace. Every tax statement that is completed needs to have one. And that means that that is the form that people use to verify their length of coverage in 2015. It's not exactly a verification either. It's a report out. And one thing that was mentioned specifically is that folks who enroll in who have coverage for one day of the month means that they are covered for that whole month, at least in terms of the penalty and the exemption. So they want to know how they can get a 1095. Those are online at irs.gov. I'm sure of that, and I think you can visit your local tax professional, and they have included that kind of thing as well. I know tax preparation softwares also include that kind of information. But you're right, that is the one that verifies their length of coverage in 2015. Great, so a couple more have come in. Follow up to the family glitch. Folks who do not have coverage for the family glitch, it does mean that they do not get an exemption, I'm fairly sure. So I'm going to follow up on that and report back on an email, but right now I'm fairly sure it means they don't get an exemption. Okay, so a couple more questions have come in. All right. Pam asked me, can you reiterate the formula to exempt a family versus individual when the employer or other insurance is not affordable? Sure. So a family, it gets an exemption if their total family coverage is not more, or is, excuse me, a family does get an exemption if the price of their insurance premiums are not more, offered through an employer, are not more than 8.05% of their household income. So that says to me that folks who have coverage offered to them that is more of than the family income, that coverage is deemed unaffordable and they are eligible for an exemption. So I am going to once again reiterate this and follow up with Molly on this stuff. But I appreciate you all asking that question again. That does seem a little at odds, so I'm going to follow up, as I said, one more time. Sorry about that. All right, so thanks for sharing some of this information in the chat bar on the right. Looks like we're sharing some smart people sharing good information is going to help us as well. Happy to see that happening here. All right, I am going to direct folks to a webinar on next Tuesday, Tuesday the 26th from 1 to 2 p.m. This information can be found at enrollnebraska.org/events. You can find, this is a webinar that TurboTax is putting on. And hopefully it's loading, and hopefully that means you guys are seeing what I see. This is a TurboTax webinar that is the tax filing season, what you need to know. And it is from 1 to 2 p.m. The webinar address, the registration address, is there at on enrollnebraska.org/events. So I encourage you to take a look at that. That has a lot more information about taxes and could probably follow up a little bit about our exemptions here. So that is good information for you all to follow up on. Let's take a look. There is going to be a follow-up survey at the end of this webinar, right when we pop it off, turn it off. And it will be about 3 questions, hopefully about 3 minutes. It gives us some information about what you'd like to learn about going forward with these webinars. We are a local Nebraska organization and one that we hope you find this valuable. So I'll also note that the next webinar is going to be in April. As I said, this is going to be after open enrollment ends, but April is going to be our next quarterly session, and we'll talk about how open enrollment is over, but there's still lots of opportunities to share health literacy and how we can get more information in the hands of the public. Lots of folks who've never had insurance before too. So that link is already at enrollnebraska.org/EEG, and I'd encourage you to take a look at that. And with that, we'll get you out a little bit early. Thank you all for being here. As I said, we are going to do some piecing together of the first and the last part of this, so you can scroll back and forth and hopefully not have any of this muted as it seemed to have been at the beginning. Thanks for bearing with us, and I appreciate everybody for being here. Have a great day.